You have a greater than 50% chance of having a current rotator cuff tear if you're above age 60. I'm going to show you exercises that you can do if you have a rotator cuff tear, especially if you don't want surgery. I'm a doctor of physical therapy. I've been a physical therapist over 6 years and treated thousands of patients with rotator cuff injuries. Isometric exercises are a great way to build strength if you have a lot of shoulder pain, especially around the rotator cuff. Some exercises you can do is shoulder retraction. So essentially I'm pushing against the chair behind me. You can hold that for about 45 seconds. And if you hold it for about 45 seconds, it can bring down pain and you're still building strength. You can push out to the side into external rotation. I'm pushing out against the chair and holding that for 45 seconds. You can also squeeze as well. If you place a pillow here, you can squeeze and just hold that for about 45 seconds. We're not physically moving, but pushing as hard as you can tolerate. If it hurts, push softer. That's an isometric exercise. The last isometric exercise is a pushing motion. So if you're facing a wall, in this case, I'm facing the couch, and I'm essentially just pushing into the couch, and I'm feeling that at the front of my shoulder and the outside of my shoulder as well. For this next exercise, we're going to have you lay on your side. We're going to lay down, and this is a great exercise for the external rotators in the rotator cuff. I'm just going to place a pillow around my head, and we're going to place this pillow here so we don't overcompensate with our deltoid. Essentially, we're just externally rotating just like this. This is a great rotator cuff builder. And if this is too easy, you can even add a weight. If you don't have a weight, I'm going to use a candle. It probably weighs about 3 pounds. We're just going to turn out. And you should feel a burn in your left shoulder blade. Another great exercise for the rotator cuff is just lifting up your arm in the diagonal plane. And it's called scaption, essentially just like that. And you want to go up to where you don't feel pain. So if you feel pain up here, you can just stop right before it. And you gradually want to build up your strength. You can take a can, any kind of a weight, just go up and then back down. The next exercise focuses on building up the serratus anterior. It's a cool muscle. It's not a part of the rotator cuff, but it helps to protract or push forward the scapula, which is very important to allow the rotator cuff muscles to do their thing. For this, we're going to have you lay on your back. We're going to grab a weight that can be super light, and we're essentially just going to push our shoulder forward and then back. We're just pushing our shoulder forward and then back. And you want to increase the weight if this is too easy. And the next level, if this is too easy, we're going to do this in a closed chain position. So essentially, we're placing both of our hands here. You can even do a push-up, or you can begin on your knees, and we're just going to push our shoulders towards the ground and then back. And if that's too easy, you can even lift up your knees, get more resistance. So I'm just moving my shoulder blades. My elbows are extended. And a push-up plus. This is great for the serratus anterior. For the next progression, we're going to have our hands and knees down here. We're just going to try to keep our body nice and straight. This couch is a little small, a little shaky, but I'll try my best. And I'm just going to tap my shoulders. And what we're trying to do is we're trying to keep our body completely still as we're tapping our shoulders. And when I lift one arm, my shoulders are stabilized. We're going to show you a few exercises on your stomach. You want to find a comfortable position. And I'm going to use just a candle, but you can use a weight as well. Do rows, pulling back, squeezing the shoulder blades. And we're also going to make an A, or we're just going to pull this weight and we're going to go into shoulder extension, bring it up to the side a little bit. These will get progressively harder. And next we're going to do T's, making a half T. And next we're going to make a Y. This is the most challenging one. All these exercises, they should be pretty tolerable. Your pain should be less than a 5 out of 10. If it gets worse than a 5 out of 10, don't push through it, and it shouldn't increase in pain the next day. You can try all of these for about 2 to 3 sets for about 10 repetitions. You can do them about 3 to 4 days a week. If you have questions about shoulder pain, post in the comments. You can join our free Facebook group in the description, and I'll answer any questions you have about physical therapy tips. Make sure you watch the next video on going up and down the stairs with less knee pain. Have a good one. Stay strong.